Urinary or excretory system. From the word excrete, to separate and eliminate or discharge waste from the blood, tissues, or organs or from the active protoplasm. Excretion in biology is the process by which organisms expels metabolic waste products and other toxic substances from their body. The urinary system performs the vital function of removing the organic waste products generated by cells throughout the body. It also has other essential functions that are often overlooked. A more complete list of its activities includes: first, it regulates blood volume and blood pressure. Blood volume and blood pressure are regulated by adjusting the volume of water lost in the urine. Releasing erythropoietin. Erythropoietin is a glycoprotein hormone naturally produced by the peritubular cells of the kidney that stimulates red blood cell production. It is required for red blood cell production. EPO is the primary regulator for production of red blood cells that transport oxygen in their circulation from the lungs to the tissues. Red blood cells, any of the hemoglobin-containing cells that carry oxygen to the tissues. Note that the number of red blood cells ranges from 4 to 6 million in each cubic millimeter of normal human blood. The red color of blood is due to the presence of hemoglobin within the red blood cells. Second, releasing renin. Regulating plasma concentrations of ions, the plasma concentrations of sodium, potassium, chloride, and other ions are regulated by controlling the quantities lost in the urine, and for calcium ions by the synthesis of calcitriol. Third, helping to stabilize blood pH. Blood pH is stabilized by controlling the loss of hydrogen ions and bicarbonate ions in the urine. Conserving valuable nutrients such as glucose and amino acids are conserved by preventing their excretion in the urine. While organic waste products, especially the nitrogenous waste products, urea and uric acid, are eliminated. And now we have here the 4 components of urinary system. These are the kidneys, ureter, bladder, and urethra.
So now let us move on to the components or the organization of urinary or excretory system. So here we have 4 parts. These are the kidneys, the ureter, the urinary bladder or the bladder, and the urethra. So the kidneys produce urine, a liquid containing water, ions, and small soluble compounds. Urine leaving the kidney travels along the paired ureters to the urinary bladder for temporary storage. When urination occurs, contraction of the muscular bladder forces the urine through the urethra and out of the body. So first, let us discuss what is kidney. The kidneys are located on either side of the vertebral column between the last thoracic and third lumbar vertebrae. The right kidney often sits slightly lower than the left, and both lie between the muscles of the dorsal body wall and the peritoneal lining. This position is called retroperitoneal because the organs are behind the peritoneum. So dito, ang kidney natin ay nasa either side siya ng vertebral column. Ang vertebral column, it is enclosed the spinal cord and the fluid surrounding the spinal cord, also called backbone, spinal column, and spine. And the thoracic are located in the middle section of the vertebral column, while the third lumbar vertebrae presented a transverse section with identical characteristic to the human. So, why the right kidney is lower than the left kidney? It's because of the large liver which sits superior to it. Yung ring kidney is 2 to 8 cm longer siya, yung sa may right. and each kidney is about 4 or 5 inches long, shaped somewhat like a bean. Para siyang bean yung kidney natin. The left kidney sits a bit higher in the body because of the size of the liver, which is also on the right side. Let us now go to the other part of the kidney. In this picture, makikita po natin yung iba't ibang part ng ating kidney. We have the renal vein, the renal nerve, the renal artery or the renal ileum, the renal medulla, ureter, capsule, the minor calyx and the major calyx, renal pelvis, pyramid, papilla, renal column, and the renal cortex. So the kidney is divided into an outer renal cortex and an inner renal medulla. The medulla contains 6 to 8 conical renal pyramid whose tips or papillae project into the renal sinus. Renal columns extends from the cortex inward toward the renal sinus between adjacent renal pyramids. Yung kidney ay na-divide siya ng other renal cortex at inner renal medulla. Ang renal cortex, ito yung nasa outside layer or its cover of many body organs. So, ang renal cortex, ito yung outer layer ng cortex natin. The cortex surrounds the inside of the organ. Tinatawag naman itong medulla. At ang medulla, it contains 6 to 18 conical renal pyramids. It is the inner part of the kidney. It consists of cone-shaped renal pyramids that contain the blood vessels and tubular structures of nephrons. So, let us now proceed to the other parts of the kidney. The urine production occurs in the renal pyramids and overlying areas of renal cortex. Ducts within each renal papilla discharge urine into a cup-shaped drain called a minor calyx. 4 or 5 minor calyces merge to form the major calyces, both of which combine to form a large, funnel-shaped chamber, the renal pelvis. The renal pelvis is connected to the ureter, which drains the kidney. We have also a minor calyx, surrounds the renal papillae of each pyramid and collects urine from that pyramid. From the major calyx, the urine flows into the renal pelvis, and from there it flows into the ureter. We have also the renal pelvis, the area at the center of the kidney. Urine collects here and is funneled into the ureter, the tube that connects the kidney to the bladder. The renal pelvis is an expanded funnel-shaped area through which urine travels. It is located within the medial concave surface of the kidney, filling the renal sinus. The apex of the renal pelvis extends outwards from the kidney and becomes continuous with the superior end of the ureter. Here we have our nephron, the unit of the kidney mainly responsible for the production of urine in order to get rid of excess water and toxic waste products. There are approximately 1 million nephrons in each kidney. At this end of the nephron, blood enters in via the afferent anterior, passes through a network of capillaries called the glomerulus, and leaves via the efferent anterior. As this occurs, components of the blood are filtered out into an area known as the Bowman's capsule. The filtered components, collectively known as glomerular filtrate, pass on into the tubules. Eventually, filtrate enters the last part, the collecting duct, and exists as urine. In men, the kidneys typically produce about 180 liters per day of this filtrate, yet only 1 to 2 liters of urine are produced each day. This means that only 1% of the filtrate managed leaves the nephrons. So, what happens to the other 99%? For the most part, filtrate is reabsorbed back into the blood at several locations along the tubule. But how can reabsorption occur? Well, the efferent arteriole doesn't just end there. It branches out to form capillaries which surround the tubules of the nephrons. The glomerular filtrate contains substances such as water, glucose, amino acids, and inorganic ions such as sodium, chloride, potassium, and bicarbonate. It also contains the waste products creatinine and urea. The next destination for the filtrate in the proximal convoluted tubule or reconvoluted means twisted or coiled. This region is lined with simple cuboidal epithelium and substances pass from basolateral surface to the apical surface of the cells and out into the interstitial fluid. Approximately 65% of sodium ions are reabsorbed here through various methods. 65% of potassium is reabsorbed as well as 90% of bicarbonate ions, which are important in maintaining the pH of the blood. But glucose and aminos are the champions here as around 100% are reabsorbed back into the blood to be used in processes such as respirations and making proteins. Note that not all urea leaves the nephron in the urine as about 50% is reabsorbed. In the secretion, well, ammonia as well as various medications are secreted into the tubule. The next part of the nephron is the loop of Henle, which has a descending limb in which the filtrate travels down and an ascending in which the filtrate travels up. The thin segments of the loop are leaved with squamous epithelium. Now, the loop of Henle drops down into a region known as the medulla. This is highly salty. Why? Because sodium is actively pumped out of the thick ascending limb, follow the chloride, but water itself cannot follow because the ascending limb is impermeable to water. This makes the interstitial fluid salty. The descending limb, however, is permeable to water but has very low permeability to ions such as sodium and also urea. In order to avoid cell damage, the amount of water and salts in the blood needs to be kept regulated and nephrons plays a vital role in this. The distal convoluted tubule, which is made up mostly of simple cuboidal cells, is the place where initial adjustments are made to the filtrate. Under the influence of the hormones aldosterone, sodium reabsorbed, followed closely by chloride, whilst potassium or hydrogen ions is secreted into the tubule. The collecting duct, which is composed of principal and intercalated cell, is where the final adjustments take place before the filtrate leaves as urine. Here, sodium chloride is reabsorbed in addition to urea. Although sometimes urea can re-enter the tubule at the loop of Henle in a process known as urea cycling. Levels of water in the collecting duct are regulated by the hormone ADH, which acts to retain water in the body. For example, if you are dehydrated, ADH allows aquaporins or the water channels to be inserted in the epithelium, allowing water to be reabsorbed back into the blood. Remember that medulla is salty, so if water is given the opportunity to leave, it will. But if you are overhydrated, a lack of ADH will mean that the collecting duct is more or less impermeable to water, so excess water can pass out into the urine. In general, urine contains water, urea, sodium, potassium, chloride, and creatinine.
Basic principles of urine production. The primary purpose of urine production is to maintain homeostasis by regulating the volume and composition of the blood. This process involves the excretion and elimination of dissolved solutes, specifically the following three metabolic waste products. 1. Urea. This is the most abundant organic waste, and roughly 21 grams of urea is generated each day. Most of it is produced during the breakdown of amino acids. Urea is an organic compound and waste product that is excreted in human urine. It is made in the liver by combining ammonia and water. Urea is the final product in a series of reactions known as the urea cycle. The purpose of the urea cycle is to metabolize protein and safely rid the body of nitrogenous waste. Second is creatinine. It is generated in skeletal muscle tissue through the breakdown of creatine phosphate, a highly energy compound that plays an important role in muscle contraction. The body generates roughly 1.8 gram of creatinine each day. And last, uric acid. Approximately 480 mg of uric acid is produced each day during the breakdown and recycling of RNA. Uric acid is a chemical created when the body breaks down substances called purines. Purines are normally produced in the body and are also found in some foods and drinks. Foods with high content of purines include liver, anchovies, mackerel, dried beans and peas, and beer. To accomplish these goals, the kidneys rely on three distinct processes. 1. Filtration. Blood pressure forces water across a filtration membrane. Solute molecules small enough to pass through the membrane are carried by surrounding water molecule. Second, reabsorption. It is the removal of water and solute molecules from the filtrate after it enters the renal tubule. This is a selective process, whereas filtration occurs solely on the basis of size. And last, secretion. It is the transport of solutes across the tubular epithelium and into the filtrate. This process is necessary because filtration does not force all the dissolved materials out of the plasma. Let's move on to the renal corpuscle. The renal corpuscle consists of 1. The capillary knot of the glomerulus and 2. The expanded initial segment of the renal tubule, a region known as Bowman's capsule. The renal corpuscle showing important structural features. The glomerular surface, showing individual podocytes and their process, a section of a glomerulus housing the components of the filtration membrane. Renal corpuscle, also called Malpighian body, filtration unit of vertebrate nephrons, functional units of the kidney. It consists of a knot of capillaries or glomerulus, as what I've said, surrounded by a double-walled capsule or Bowman's capsule that opens into a tubule. Renal corpuscle regulate the concentration of water and soluble substances like sodium salts by filtering the blood, reabsorbing what is needed and excreting the rest as urine. A renal corpuscle is the initial blood filtering component of a nephron. The blood supply to the kidney. In healthy individuals, about 1,200 ml of blood flow through the kidneys each minute, or some 20 to 50% of the cardiac output. This is a phenomenal amount of blood for organs with a combined weight of less than 300 gram or 10.5 ounce. As the renal artery enters the renal sinus, it divides into branches that supply a series of interlobar arteries that radiate outward between the lobes. They then turn arching along the boundary lines between the cortex and medulla as the arcuate arteries. Each of the arcuates gives rise to a number of interlobular arteries supplying portion of the adjacent lobe. Afferent arterioles branching from each interlobar artery deliver blood to the individual nephrons. Blood flows into your kidney through the renal artery. This large blood vessel branches into smaller and smaller blood vessels until the blood reaches the nephrons. In the nephron, your blood is filtered by the tiny blood vessels of the glomeruli and then flows out of your kidney through the renal vein. The renal arteries carry a large volume of blood from the heart to the kidneys. The kidneys filter waste and excess fluid from the blood. You have two renal arteries. The right renal artery supplies blood to the right kidney, while the left artery sends blood to the left kidney.
Good day. So now let us proceed to the significant differences between urinary and plasma solute concentrations. Here, we can identify the difference of urinary and plasma solute concentrations. Under ions, we have sodium, potassium, chloride, and bicarbonate. Under metabolites and nutrients, we have glucose, lipids, amino acids, and proteins. And lastly, under nitrogenous waste, we have urea, creatinine, and ammonia, and uric acid. Next, we are going to discuss the possible treatments of kidney failure. Kidney failure or renal failure occurs when the kidney become unable to perform the excretory functions needed to maintain homeostasis. Many different conditions can result in acute or chronic renal failures. So, a person has a kidney failure or renal failure if his or her parts under urinary system cannot perform or function well. There are a lot of kidney diseases such as kidney stones, infections like urinary tract infections or UTI, and kidney failure. So today we are going to talk about the two types of kidney or renal failure, which are the acute renal failure and chronic renal failure. Acute renal failure occurs when exposure to toxic drugs, renal ischemia, urinary obstruction, or trauma causes filtration to low or suddenly stop. This renal failure occurs when someone tried to use toxic drugs, pati na rin yung kung pinipigilan natin ang ating urine, which can cause filtration to low or suddenly stop. On the other hand, in chronic renal failure, kidney function deteriorates gradually and the associated problems accumulate over time. Here, it says that chronic failure occurs kung yung pag-function ng kidney ay unti-unti nang nagde-decline. Management of chronic kidney failure typically involves restricting water and salt intake and reducing caloric intake to a minimum with few dietary proteins. This combination reduces strain on the urinary system by minimizing the volume of urine produced and preventing the generation of large quantities of nitrogenous waste. Acidosis, a blood plasma pH below 7.35 is a common problem in patients with kidney failure. Next, if drugs, infusions, and dietary controls cannot stabilize the composition of the blood, more drastic measures are taken, such as dialysis or kidney transplantations. So, based on the kidney failure that we discussed, we have these two major treatments that can be done. First is the dialysis, and second is the kidney transplant. First, let us talk about the dialysis. In dialysis, the functions of damaged kidneys are partially compensated for by diffusion between the patient's blood and a dialysis fluid whose composition is carefully regulated. When the kidneys stop functioning properly, dialysis is a treatment used to eliminate waste materials and extra fluid from the blood. The blood is frequently directed to a machine to be cleansed in this process. Then, in a kidney transplant, the kidney of a healthy donor is surgically inserted into the patient's body and connected to the circulatory system. When we say kidney transplant, ito yung paglagay ng healthy kidney ng iba sa loob ng patient's body dahil sira or hindi na nagfa-function ng mabuti yung sarili niyang kidney. This treatment is used for someone who have a kidney failure just like chronic renal failure. Compared with dialysis who has a higher risk of death, kidney transplant can make you feel better and live longer. Next slide is the urine transport, storage, and elimination. So, filtrate modification and urine production and when the fluid enters the renal pelvis. The urinary tract, the ureters, urinary bladder, and urethra is responsible for the transport, storage, and elimination of the urine. Nephrons take a simple filtrate of the blood and modify it into urine. The term forming urine will be used hereafter to describe the filtrates as it is modified into true urine. So yung filtrate modification at urine production ay mag-e-end kung nakapasok na sa renal pelvis yung fluid. So, what is renal pelvis? It is the main blood vessel that carries blood from the kidney and ureter to the inferior vena cava. Hence, this is a way for blood to enter the kidney. Additionally, the urinary tract, yung ureter which is responsible sa pagtransport or paglakbay ng urine. Yung urinary bladder naman which is responsible for temporary storage. And lastly, yung urethra which is responsible sa paglabas ng urine sa ating katawan. This one, the ureter is the second component of urinary or excretory system. So, the ureters are a pair of muscular tubes that carry urine from the kidneys to the urinary bladder, a distance of about 30 cm or 12 inches. Each ureter begins at the funnel-shaped renal pelvis and ends at the posterior wall or the bladder without entering the peritoneal cavity. The ureteral openings within the urinary bladder are slit-like, a shape that prevents the backflow of urine into the ureters or kidneys when the urinary bladder contracts. So, just like what I've said a while ago, ito yung responsible sa pagtransport ng urine from the kidney to the urinary bladder. Dito dumadaan yung urine mula sa kidney papuntang urinary bladder. In other words, the ureter is the tube that connects the kidney and urinary bladder that carries waste product just like the urine. So, yung ureteral opening within the urinary bladder ay responsible para ma-prevent ang urine sa pag-flow backward nito. So, next, the wall of the ureter is consists of 3 layers, which contains an inner expandable transitional epithelium, a middle layer of longitudinal and circular bands of smooth muscle, and an outer connective tissue layer continuous with the renal capsule. About every 30 seconds, a peristaltic contraction begins at the renal pelvis and sweeps along the ureter, forcing urine toward the urinary bladder. So, every layer of ureter has their own functions in transporting the urine. And yung contraction ay nag-uumpisa sa renal pelvis, which is yung sabi ko kanina, renal pelvis is the main blood vessel that carries blood from the kidney to the ureter. Okay, next. These are the layers of ureter which includes the fibrous coat, muscular coat, and the mucosa. First is the fibrous coat, which is a supporting layer of fibrous connective tissue. This is the outer layer of the ureter and its function is to support the connective tissue. Second is the muscular coat, which consists of the inner circular and outer longitudinal smooth muscles, and the main functions of this layer is peristalsis, to propel the urine. This is the middle layer of the ureter and its function is peristalsis. What do we mean by peristalsis? So, peristalsis is a series of involuntary wave-like muscle contraction which move food along the digestive tract and also which move the urine to the urinary bladder for temporary stay. Meaning, ito yung nagpapagalaw o nagtutulak sa urine para lumabas from urinary bladder to the urethra. Lastly, the mucosa is transitional epithelium is continuous with the lining of the renal pelvis and the urinary bladder. This is the inner layer of the ureter and it is responsible for the waterproof properties. Also, it is a thick, slippery fluid that coats and moistens urinary tract. So that ends my part and thank you.
Urinary bladder. It is a temporary storage reservoir for urine. It is located in the pelvic cavity, posterior to the symphysis pubis and below the parietal peritoneum. The size and shape of the urinary bladder varies with the amount of urine it contains and with the pressure it receives from surrounding organs. The bladder can stretch to hold up to 2 cups of urine. The general volume of the human bladder will vary from person to person. The range of urine that can be held in the bladder is roughly 400 ml to 1000 ml, with the average capacity being 400 to 600 ml. We can also notice if we are hydrated or dehydrated from the color of our urine. The color of urine can reflect if you are drinking enough water. It is usually light yellow if you are drinking enough water and dark yellow if you are not. In males, the base of the urinary bladder lies between the rectum and the pelvic symphysis. In females, the urinary bladder is inferior to the ureters and anterior to the vagina. The triangular area within the urinary bladder that is bounded the urethral openings and the entrance to the urethra constitutes the trigone of the bladder. The surrounding of the urethral entrance is called the neck of the urinary bladder. It contains a muscular sphincter that also extends along the proximal portions of the urethra. The internal urethral sphincter provides involuntary control over the discharge of urine from the bladder. The middle layer of the bladder will consist of inner and outer layers of longitudinal smooth muscle with a circular layer in between. These layers of smooth muscle form the powerful detrusal muscle of the bladder.
Let us now move on what is urinary tract infections. Urinary tract infections or UTIs result from the colonization of the urinary tract by the bacteria or fungi. The intestinal bacterium Escherichia coli is most commonly involved. Women are particularly susceptible to UTIs because the external urethral orifice is so close to the anus. Sexual intercourse can push bacteria into the urethra. Because the female urethra is relatively short and the urinary bladder can then become infected. If inflammation of the urethral wall occurs, the condition is termed urethritis. Inflammation of the lining of the bladder is called cystitis. Many infections, including sexually transmitted disease or STDs, such as gonorrhea, cause a combination or urethritis and cystitis. The bacteria, which is called the E. coli, is the culprit about 90% of the time. The E. coli normally lives harmlessly in the human intestinal tract, but it can cause serious infections if it gets into the urinary tract. In women, the trip from the anus to the urethra is a short one. This is the reason why wiping front to back after using the toilet is helpful in preventing UTI. An untreated UTI can move up to the kidneys and cause an even more serious infection. So, prompt diagnosis and treatment is important. Sexually active women, pregnant women, and older women all may be at increased risk for UTI. The question is, how can we prevent UTI naturally? So the best thing you can do to prevent a UTI is drink plenty of water. Staying hydrated causes you to use the bathroom more frequently, flushing out any potentially harmful bacteria on a regular basis. Other things you can eat and drink to help prevent a UTI include foods such as a yogurt that contain probiotics.
Urethra. The final passageway for the flow of urine is the urethra. a thin-walled tube that conveys urine from the flow of the urinary bladder to the outside. The opening to the outside is the external urethral orifice. In males, the urethra allows for the passage of urine from the bladder to the outside of the body, or urination, and is also responsible for the expulsion of sperm during ejaculation. The urethra extends from the neck of the urinary bladder to the exterior. In females, the urethra is very short, extending 2.5 to 3 cm or about 1 inch from the bladder to its opening in the vestibule anterior to the vagina. The proximal urethra is the part near the bladder. The distal urethra is approximately the last 1/2 inch. While the distal urethra is closest to the outside of the body, the urethra is the tube through which urine leaves the body. In women, the distal urethra is approximately the last 1/2 inch, as what I've said, and in men, it is the part of the urethra in the penis. In males, the urethra extends from the neck of the urinary bladder to the tip of the penis, about 18 to 20 cm or 7 to 8 inch in length. The prostate gland is located just below the bladder and in front of the rectum. It is about the size of a walnut and surrounds the urethra. It produces fluid that makes up a part of semen. As a man ages, the prostate tends to increase in size. Proximal urethra, it is the part that goes through the prostate gland. The prostate's primary function is to produce the fluid that nourishes and transports sperm or seminal fluid.